Val Kilmer passed away on April 1st, 2025, at age 65 with his daughter, Mercedes Kilmer, confirming pneumonia as the cause, as reported in various news outlets. There is no specific mention in available information that it was aspiration pneumonia. Without official medical details such as an autopsy report, it cannot be confirmed. However, given his history of throat cancer and tracheostomy, which could increase the risk of aspiration due to swallowing difficulties, it's possible. Pneumonia can have various causes, including bacterial, viral, or fungal infections, and aspiration pneumonia is just one subtype, making the distinction important but unclear in Val Kilmer's case. Aspiration pneumonia occurs when food, liquid, or stomach contents are inhaled into the lungs, often due to swallowing issues, and can be more common in individuals with conditions like throat cancer, which Kilmer had history of. However, reports do not specify if it was aspiration pneumonia, making it uncertain. Aspiration pneumonia is a serious condition. Its prevalence varies widely, from 10% to 70%, and the mortality rate can be as high as 70%, depending on the severity of the disease. It is a bacterial lung infection resulting from inhaling substances such as food, liquid, saliva, or stomach contents into the respiratory tract, leading to swollen and fluid-filled air sacs, alveoli. This condition often occurs silently, with symptoms developing days or weeks later, making it a significant health concern, particularly for vulnerable populations. Symptoms of aspiration pneumonia include fever and chest pain, treated typically with antibiotics. Here's the kicker. The primary cause is the inhalation of non-air substances, including saliva, mucus, stomach acid, vomit, food, beverages, or small objects. If the person is unable to cough these out, bacteria can grow, resulting in inflammation and infection. Aspiration pneumonia is more likely in groups with specific situations. Anesthesia or dental procedures can impair swallowing reflexes temporarily. Throat cancer and tracheostomy can increase the risk of aspiration due to swallowing difficulties. Swallowing disorders, dysphagia such as stroke, brain injury, Parkinson's disease, multiple sclerosis increase the risk. Alcohol or drug impairment, living in assisted facilities, or poor oral health. Children under 5 and adults over 65 are at higher risk due to developmental or age-related issues. Among these specific groups, the condition is a major category with significant morbidity and mortality risks. Mortality rates can reach up to 70% depending on the volume and content of the aspirin, and are particularly high in hospitalized patients with swallowing disorders. Among patients aged 70 or older hospitalized with pneumonia, dysphagia prevalence was reported at 91.7%. Symptoms typically include fever, shortness of breath, coughing up blood or pus, chest pain, and tiredness, which may take days or weeks to manifest. Diagnosis involves a healthcare provider assessing symptoms and medical history, focusing on swallowing and coughing ability, often supported by chest x-rays to identify infiltrates. Differentiating it from other pneumonias can be challenging, especially in cases of multiple microaspirations. Complications can include sepsis, a life-threatening reaction, or respiratory failure, both of which can significantly worsen outcomes. Most patients survive with appropriate treatment, but frequent choking or difficulty swallowing warrants medical attention, and symptoms such as chest pain, fever, or difficulty breathing require emergency care. Preventing aspiration pneumonia involves managing underlying conditions such as gastroesophageal reflux disease, GERD, or swallowing coughing issues, and adopting lifestyle measures. Key strategies include avoiding excessive alcohol and staying upright while eating or drinking, chewing slowly and thoroughly to reduce choking risks, practicing good dental hygiene and visiting the dentist regularly, avoiding smoking, vaping, nicotine, and misuse of illegal drugs or prescriptions. These measures are particularly important for at-risk populations. If you have any questions or comments, please don't hesitate to leave them below. If you found this video helpful, we'd appreciate it if you could like and subscribe. Thank you for watching.